Zika is a huge global health problem and a priority that is linked to severe birth defects and other types of health concerns. And there are leaders around the world who are struggling about what to do with respect to the Zika virus. And certainly leaders in the US are trying to take a significant stance with respect to that. It's critical that we find out more answers about this particular virus and figure out what we can do to control what is now already a pandemic and could be a pandemic with very significant outcomes and complications for us going forward.
To be sure, there's a lot we don't know. You'll hear a good bit of that this morning. A lot we don't know and need to know about the Zika virus, its causes, its epidemiology, its relationship to other conditions, the totality of its effects. But there are some things we do know. We know that Zika carries with it the potential for serious negative public health consequences, including microcephaly, which leave newborns burdened with horrible, lifelong physical and mental developmental defects, and cost millions of dollars to treat. The estimate I've seen is $10 million average per case. We know that the CDC has warned us that the mosquitoes that carry this virus will reach as far north as Maine this summer, including the entire state of North Carolina, and that other countries and US territories are already beginning to experience the impact of the crisis, with its full impact yet to come. And we know that confronting this threat will require a major mobilization of resources, public and private, federal, state, and local, scientific, technical, and social.
We've set aside traditional rivalries to bring together researchers from major universities in the Triangle, as well as industry and the nonprofit sector. And our discussion is going to be fairly wide-ranging. But there's a common thread here in that all the researchers that you're going to hear from are really at the frontier as we are addressing this virus.
So we need a Zika vaccine, and I work at the Human Vaccine Institute at Duke, and so we are very interested in furthering that work. I think there are three important things to a vaccine that we're going to need to overcome. One is understanding natural immunity and how that relates to the fetal infection. The other is having accurate diagnostics. We're not going to be able to tell if our vaccine works if we can't diagnose the infection. And then having animal models of disease that can accurately predict whether a vaccine is going to work. So I have previously worked in non-human primate models for congenital infections, including HIV and cytomegalovirus, and worked with David O'Connor at University of Wisconsin to help develop a congenital transmission model in non-human primates. And David O'Connor has been pushing the field forward by making his data available in non-human primates online in real time, and that has been a great asset to the community. And recently they showed that upon re-challenge, so monkeys can become infected, as seen by the viral load there on the first quarter of the graph. And then they later went back 70 days later and tried to re-challenge those animals, and the animals were protected. That's very good news for a vaccine, that natural immunity seems to be protective against a new infection. However, some potentially bad news that came from the monkey model is that while the viremia was pretty short-term in most of the animals they infected, between 7 to 10 days, and that accurately reflects what's going on in humans, pregnant monkeys, interestingly, had a much longer viremia. They were viremic up to 30 days for 2 animals and up to over 70 days for another animal. One animal had a more typical course. So this is potentially bad news for controlling this virus in pregnancy. This is either immune deficiency of pregnancy, that immune changes that happen to maintain the fetus, or potentially a fetal infection that's maintaining the maternal viremia. And so this needs to be studied and understood. What is the missing part of the immune system that helps control this virus in pregnancy?
We're looking at the use of drones to support vector control. So we're using drones, and we've done flyovers on 4 villages in Guatemala and then coded that data for possible breeding sites. We've then downloaded that data onto tablet computers and given them to the vector control teams on the ground to allow them to use those during their spraying and other eradication efforts. We're also looking at the use of smartphones to collect data and to support families who have microencephalitic children in Brazil. So smartphones can be used not only for primary data collection with the families in real time, but also used as a way to push out information to the families and intervention strategies for them as they raise their children. We're also studying the potential for aerosol transmission of the Zika virus. We know that the virus can be found in human saliva, but what we don't know if the saliva is aerosolized, can it be transmitted to humans? We're also monitoring social media and the public's response to that social media in an effort to have that information when we design effective communication campaigns. So we're monitoring media in Guatemala as well as in the United States.
We have a very simple strategy for responding to Zika. We are very much collaborating with our colleagues at CDC, at NIH. Within our space, we have prioritized 3 functional areas. We want to prevent Zika disease by supporting the development of vaccines. We want to enable the detection of Zika disease by supporting the development of diagnostics that could be used in commercial labs or in doctors' offices. Our colleagues at CDC, when Dr. Beach gets on, you'll hear about their efforts to expand public health laboratory capacity. We complement that by supporting the development of diagnostics by commercial firms. And then the last area that we have focused on is protecting the blood supply by supporting the development of screening tests for donated blood, as well as pathogen reduction technologies to take blood that's been donated and essentially to cleanse it of viruses, including Zika or other pathogens.
I hope that this has been a helpful session, though, in terms of informing us better about what each other are doing and about the requisites of success going forward. This is a big one, and it's a big one politically as well as in other ways, and we have a lot of work to do. Thank you so much. Thank you to RTI.
And please join me in thanking Congressman Price for this idea and the inspiration.